We are at Alcohol Policy Part 1, Essentials for Prevention Practitioners. Note Part 1, so that tells you there's a Part 2. Part 2 is same place tomorrow, same time tomorrow. So please come back for Part 2 of this alcohol policy series. You'll get more opportunities to hear from Maureen Busalaki, Director of the Wisconsin Alcohol Policy Project. She's a Southwest PTTC consultant, and we're excited to hear from Maureen today. On our next slide, you'll see an acknowledgement as to who we are in the Southwest. So it's a pretty simple acknowledgement. It says, it shares with you who our grantor is, which is the Department of Health and Human Services, Substance Abuse and Mental Health Services Administration. It also tells you that, they do not officially support nor endorse anything that is said here today as well. You all a little bit about the Southwest. We are headquartered here in Norman, Oklahoma at the University of Oklahoma in the Southwest Prevention Center. We serve the great states of Oklahoma, Texas, New Mexico, Arkansas, and Louisiana. And certainly because we are a part of a national network, the Prevention Technology Transfer Center Network, we welcome folks from all across the country. And so without further ado, I'm going to turn the time over to our presenter today, Maureen Busalaki. Maureen.
Thank you so much. Really excited to be here today. And did we share the results of the poll?
We have not, Maureen.
Okay, maybe we can do that first.
Okay, it's up.
Great. So it looks like we've got a mix of experience, and I really appreciate folks taking a moment to share kind of where they are. Because that helps me understand and calibrate a little bit in terms of the material and some of the examples I'll share today. But we do want this to be interactive. So we're looking forward to hearing your comments and ideas and things that you've experienced and seen as well. Okay, and then Richard, do we have the second poll?
I've got the one that's further down on the list.
Okay, sorry, I thought we were doing, that's fine. All right, so the agenda's in front of you. So we want to do some welcome and introductions. We are going to talk about the essentials of alcohol policy, talking about public health advocacy, lobbying fundamentals, and getting us started in local alcohol policy. So our learning objectives are on the screen. We want you to walk out with some clear tools and definitions, being able to provide examples of alcohol policy, how it is an important part of a comprehensive prevention approach, understanding what public health advocacy is, and the importance of having alcohol policy, things to think about before you deal with lobbying, whether you can or cannot, and what those parameters are, and some activities to get you started. So first of all, welcome. Let's hear about all of you in the webinar. So if you could please put your name and organization in the chat, that would be great. So give you a couple minutes here to put in your name and your organization.
So Maureen, we're seeing some folks from Texas, lots of names coming through. Aaron Rowland, welcome. Shelley Ball, welcome. Melissa Russell, welcome. Leslie Vivar, welcome to the call as well. Kayla, Derek Newby, Katie Allen, hi to you too. Chris Pyle, Sharon Crook.
We even got some Wisconsin folks on. Hi, Betsy.
Nice. Christelle Corpus from Hawaii is here, so as far away as Hawaii. Bryce Riddle, another partner that we have here at the Southwest Prevention Center. Started out in his prevention work as a teen, working in partnership with one of our coalitions, and now is an employee here at the University of Oklahoma's Southwest Prevention Center. So welcome, Bryce, my friend. We have Dale from Louisiana and Rachel from Minnesota. Paula Feathers, an old friend of ours from New Mexico, is here. Jenny Adam is here as well. Amanda Levin and Lori in Nevada. So some of these names are moving quickly. If I missed you, my apologies. Chad Childs. Hi, Chad. It's been a long time, friend, from Wichita, Kansas. We've got Blake Reddit from Wichita and affiliated tribes in Anadarko, Oklahoma, just down the street from me. Welcome. To Wanda Talley with the Indian tribe, the Nottoway Indian tribe in Richmond, Virginia. Welcome from Richmond, Virginia. Nicole Butte from the Southern Plains Tribal Health Board. Yolanda Yancey from Baton Rouge, some more folks. As far as ways, New York, we've had people. Liana Munez and Iowa Alliance of Coalitions for Change. Kata is here. We have Dr. Coraline Griffith Hunt, also from New York. Robbie Mullins. We have someone from Canada. So we have Ziane Harvey Jansen, and my apologies if I'm butchering your name. It's certainly not on purpose. More folks from Ashley Tillison from the Louisiana Department of Health. Welcome. Sherry Hansen from OSU, Oklahoma State University Wellness in Stillwater. She's an Oklahoma prevention specialist. Welcome. We're so glad to have you here. Cecilia from Pineville, Kentucky. So we have a nice cross-section of folks for this conversation today. Welcome you all. And if I missed your name, they're moving so quickly at one point, my apologies, but certainly we are glad that you all have joined us today.
All right, so great to see folks and such a wide swath of folks and experience. I'm really excited to get started today. So just really quickly, I wanted to give you a little bit of background about me. So I grew up in a farm in Wisconsin, so prototypical, right? But we mostly had horses. And I have two daughters, 16 and 18, and my husband, we did a trip in Utah. So that's just a little bit about myself. For this work, I started working on political campaigns. You know, back when we had horses and buggies. I ran Smoke-Free Wisconsin, and we passed 2 tobacco tax increases, prevention funding, and kind of the crown jewel of the smoke-free air law. I've also worked for the Advancing a Healthier Wisconsin Endowment at the Medical College of Wisconsin and oversaw 45 projects that are working to change systems and policy to improve health. And now I'm the current director of the Wisconsin Alcohol Policy Project. I'm located at the Medical College of Wisconsin at the Comprehensive Injury Center. I've also chaired the State Council Ad Hoc Work Group on reducing excessive alcohol use in our state that has 61 recommendations, for use for civic, religious, educational organizations, local government, state government, and just a touch for the alcohol industry to think about. And I'm co-chair of the Wisconsin Public Health Association Policy and Advocacy Committee. So I consider myself really public health. I have kind of a niche in our state on doing public health advocacy.
Maureen, we have your second poll, so we could put the just
let's
right
do
now.
that. Yes.
So Richard, please publish the second poll. What you've learned. So the poll is.
That's a little bit later.
That's a little bit later. This is the wrong. So
yep.
We'll just go
hold on that one. Yep.
I've got it. Just hold on one second.
Okay.
Mm-hmm.
So what we're waiting on is just getting an idea of what role you have played in policy work. So here we go. It looks like we've got it up now. So understanding, what you've done, because that's really helpful to see the different jobs. And obviously, some of you have done a lot of them or all of them. So this is great. Just give you another minute or so to, because we're going to talk about all of these different roles in this advocacy process. How about another 20 seconds? Jump in if you haven't. All right, do you want to share that? The results? Okay, so we can see from the polling that we've got a wide variety of experience in working on this. And I love to see the work to empower others. That's really great. And that is something that we can all do. And then there's different, different kinds of roles that we all play during different, you know, advocacy campaigns or just, in the work that you're doing. So thank you. We'll go ahead and stop sharing that. And let's get into the essentials of alcohol policy. So what I'm sharing is a definition from the National Association of Alcohol Abuse and Alcoholism. And as you can see, just by reading this, alcohol policy is complex. Not that you didn't already all know that, right? And the industry is also complex and they're not uniform. So that's just something to think about here. So there's those who manufacture alcohol, sell alcohol. I would add distribute alcohol because that is the 3-tier system that we're under that's supposed to help protect public health. Of course, who can drink alcohol and responding to alcohol related problems. So depending on your state, the different regulations may vary, and it also may vary whether it's a statewide, like a ABC, alcohol beverage control system, or if it's a state and local control system, or if it's just a local control. Um, in in Wisconsin, which we're a little bit unique, is that we have kind of just a framework, but most of the control is local. There's certainly some things that the state does, but it lies on our home rule. So it's a little bit unique, but it also can play into how you can work within these policy definitions. There's also different systems at play to think about. There's the legal system, law enforcement, licensing, regulation, transportation. So again, just adding to the complexity. Um, the other piece about this definition that I just wanted to point out is it says it responds to alcohol related problems instead of preventing alcohol related problems. So that's kind of my add-on to that piece. I'm sure many of you have seen this next slide. It came about in the late 80s, really looking at the EPI data and the increase of understanding that alcohol problems are not just an individual, right? There's a lot of complex interaction between our environment and social factors. And, back in the day, there some that thought it stemmed from, a particular mechanism in a person, like a genetic susceptibility for alcohol dependence. But definitely that has changed over the years as more research and evidence has come forward. And so I want to talk through this model a little bit with you. So the host, or some also call it the agent, are alcohol beverages or ethanol itself. And so the amount of alcohol, the price, promotion, location, and just think about, you know, back in the day, right? Let's just go back to the 70s as an example. Um, you didn't have beers that had 19% alcohol in them, right? Or at least they weren't sold on the regular marketplace. And so now a lot of that has changed. We now have a binge drink, frankly, in a can. And so while the alcohol itself, the ethanol, has not changed, how much and how it's marketed and promoted has definitely changed. Then the individual, these are the traits of people and how you metabolize alcohol, your knowledge, your attitudes, your perceptions, and of course, your genetic susceptibility. And then there's the environment. That is the physical, interpersonal, or social surrounding the use of alcohol. Um, and that regulates the individual exposure to alcohol and the risk with the agent to alcohol. So think about this in terms of our microenvironment. There's also like your legal environment, what's allowed in your location, um, and thinking about laws about driving under the influence, minimum purchase age laws, zoning. How available is it in your neighborhood, in your state? What are the pricing strategies and excise tax rate? What kind of promotions? Kind of the physical aspects of the drinker's immediate environment. So this frame is a little bit different than other drugs. So I came from tobacco control, and I remember sitting down with a great researcher on alcohol policy, and he was really telling me about how with tobacco, it doesn't take long to become addicted. But alcohol, there's a lot of people who use alcohol that don't have an alcohol use disorder. So the response in terms of the environment has also needs to be different than it is for tobacco. Um, that there's no safe level of tobacco. And there's certainly places where there's no safe level of alcohol, like for our kids and those who are pregnant, but also those who are working on sobriety and things like that. So what this tells me though, and when you think about it, that you've got about 10% of those who drink have an alcohol use disorder. That means you have, 90-ish%, maybe a little less, maybe a little more, um, that don't have an AUD. We have a real opportunity to fix the environment so that we can kind of bring this back a little bit, because we certainly have a problem in our state. So I'd like folks to put into the chat, when you look at this triangle, where does most of your work take place? Is it with the host? Is it with the individual, or is it in the environment? So I'm seeing environment. Some individual, yes. Right. Great. So seeing a large number of environment, some doing work on both the individual and the environment. So that's great. All right, thank you for that. So the goal of alcohol policy really is 4 things. Those negative consequences of alcohol consumption. So thinking about drinking, driving laws, for example, underage drinking, they all have negative consequences, like obviously driving while under the influence. What can happen to kids when they're drinking? I don't think you need me to tell you all of that. And then looking at the next one, influence individuals' risky alcohol consumption. So things like closing the bars early. There's this argument from the alcohol industry that if you leave the bars open, that'll be better. But all we find is that it seems people drink more, and then there's more consequences related to that. So closing those bars early can be helpful in reducing that risky consumption. Thinking about ball games, during their alcohol purchases at the seventh inning, for example. And thinking about rules and enforcement of over serving alcohol at different events like festivals. That over service of alcohol, if people aren't trained about that, can be a real problem. Um, and then risk factors associated with alcohol related problems and consequences. So thinking about the community, how much alcohol do kids see and what happens? So for example, we've got neighborhoods in our state where you have to go through the alcohol section at the convenience store to get your groceries. We also find when there's a lot of density, there seems to be a lot of child neglect that can happen as well. There's some research on that and ACEs. Um, Thinking about underage access to alcohol. So who's swiping IDs? We've had some checks where if the person tried to buy and were not of age, they swiped their ID and it didn't work, and then they just took theirs out and swiped it. So that's not a great way to restrict alcohol access to our folks who are underage. And then how does the community handle their events? Do you have a social norm and thinking about consequences of having open containers and being able to walk around with alcohol? And then there's disincentives for individuals and organizations that contribute. So thinking about sting operations, looking for bartenders serving intoxicated patrons, that can be a real problem for your next license renewal or sooner, depending on the rules in your community. Um, you, there's many places where you find organizations that sell alcohol to minors. You can lose your license in many places by not following the law when it's regarding to the alcohol age compliance checks. And maybe you can't hold an event the following year. So now we want to talk about some of these different policies. So regulating alcohol density. My guess is that this crowd is pretty familiar with alcohol density, but that's the number of outlets you have for the population. And it's complicated, right? Because we've got the on-premise, the bars and restaurants, and then we have the off-premise, which are convenience stores, grocery stores, liquor stores, gas stations in our state, and just how much density, is there. Alcohol taxes, and alcohol taxes, really drive how much people can buy. And then there's also the potential of using that revenue for good. Dram shop, which is really, limits on service so that if you overserve, there are true consequences to your alcohol license. Days of sale. So do you sell alcohol 7 days a week? Not every state does. And then how many hours is alcohol available in your community? So the electronic screening and brief intervention. So this, I think, is really interesting because this is where that individual piece comes in. How do people react to their environment and how can they think that through a little bit better with some assistance? And enhanced enforcement. So for laws prohibiting sales of minors. So recently in our community, the police did an operation and they found 134 underage drinkers in one bar. So that would be enforcing the law, right? Um, can't wait to hear the end of that story. So now that you've absorbed all of this information, it's a pop quiz. So if we could pull up the poll. Great. So the first one, we wanted to just give you a chance to think through the goal about limiting days and hours of sale. And what are those factors? So I'm going to give you all a couple minutes to think that through and answer the poll. All right, jump in, folks.
We're up to about 50% response right now.
All right. All right, let's give you another 10 seconds. Jump in, folks. Okay. Looks good. Let's close that and see what folks had to say. All right. So you can see the answers were kind of all over the board in terms of, what those different pieces were. Decrease the negative consequences of alcohol consumption. About 46% of you said. And just, thinking about that, I'm just pulling up something here. Generally those have been well, actually, if it's okay, why don't we open the chat and have folks explain why they chose that? I'd be interested. Decrease the negative consequences of alcohol consumption. Does anyone want to jump in and tell us why you answered that way? Or are you all going to be quiet on me? So may cut down on crashes. Right, if you don't have as much time to buy or purchase alcohol at a place, you might reduce availability and alcohol crashes. More hours, more purchasing. Yes. And then influence individuals' risky alcohol consumption practices. Who answered that? It looked like about 36% of you did. All right, the same applies. More hours available for purchase, more potential for heavy drinking, reducing availability. Risk factors associated with alcohol-related problems and consequences. So reducing the sales and hours. So again, reducing the availability of it. And then disincentives for individuals and organizations that contribute to risky alcohol behavior. Does someone want to share what they were thinking when they answered that one? You're all going to be quiet on me now. I think that was more intended to, look at what you do with those who hold licenses. You might not be able to hold an event the next year. You might not renew your license. So, okay, let's do the next one. So the role of alcohol density. How does that play in with alcohol policy? Looks like there's quite a few answering the question. We'll give you a minute or so here to think about what those concepts of alcohol policy mean and how it applies to the goal of reducing alcohol density. So if folks want to, again, put into the chat what you were thinking when you answered that question. What are some key points about the concepts of alcohol policy and dealing with density?
So Maureen, as we're waiting, I'm thinking to myself, do some of these goals also, can they also be used for, say, cannabis policy work or tobacco policy work?
Man, it's a great question and a big capital letter yes, absolutely. These are not exclusive. These were certainly things in tobacco that we would work on. But I'm sure those who are working in cannabis would see that as well. So Jerry thinks access, availability, and quality of life in a neighborhood. Reduced access reduces harm. That's certainly played out from the research. Okay.
Looks like we're holding at about 60% of the responses.
Okay, great. So we can go ahead and end that and share the results with everyone. So the most common answer was the risk factors associated with alcohol related problems and consequences. And I would say that is a big part of why you look at alcohol density. We know there's violence associated with that. The industry itself tends, when it's more competitive, they tend to compete with each other. And sometimes those are in underage sales, gray sales, as we called them in the past. It can lower the price of the product, how much you're charging for cocktails. So, yep, and access to individuals' daily environment definitely relates to the risks. So, great. Thank you for the pop quiz and participating in that. And feel free as we're going along, if you have any questions as we're talking, be happy to answer those as we go. So where do you find alcohol policy? So there's some great resources. The community guide is a resource, that's done, I believe, in collaboration with the CDC in terms of looking at what are those best practices, but the community guide gives a lot of detail and great information. There's also a What Works for Health. So this is the Robert Wood Johnson Foundation work that puts policies up against the evidence-based And so you can see what's happening. So sometimes you'll be working with a coalition and they might have an idea, but the evidence isn't really there for that. So it's really helpful to both help focus on what does work, but also understanding what is not as effective. And then there's a lot of other state and federal agency resources. Every state is different. So depending on your kind of legal regulatory framework, it's really important to see what you've got in your state. So your health department might have resources. Sometimes academic institutions will be helpful in your state. Of course, the PTTC. So there's a number of places, but in the resources that we give you at the end here, there's some of those that you can look at for those model policies. But here's the things to consider when you're looking at those. Again, your state's framework, does this work? So for example, the CDC has 26 items related to reducing underage drinking. And there's about, I don't know, 8, 9 of those that are not compatible with our state law. So we've got some work to do. But just knowing that every recommendation doesn't necessarily fit. And depending on who controls alcohol and what you're trying to do with it. Sometimes there's constitutional issues, and then there's legal issues too to consider. So again, those can generally, you can figure those out with some help, from the PTTC, as well as other health departments or agencies generally have some resources for you in that. There are additional resources. The U.S. Alcohol Policy Alliance is one. Stop Alcohol Abuse, which is, really looking at preventing and reducing underage. So there's a number of resources. Again, we included that in your materials. So sometimes this gets to be the elephant in the room. When we talk policy, people immediately are concerned about lobbying. So who can you talk to, under what circumstances, all of those questions. So we don't have time to answer all of them today, but we're going to try to give you some tips and ways of figuring things out for you, your organization, and the rules that you have in your state. So we're going to start with advocacy. So to me, this is good, clean fun. So what is it? It's educating, organizing, and mobilizing for systems change in population health. Now notice I didn't say, laws, but there's a lot of systems changes that can happen. Public health's responsibility is looking at current and future threats to the health of the community. And so they work with the community to identify and inform the community about what those are, including those who are decision makers. So public health advocacy occurs through the media, through legislative and grassroots efforts, and individual health advocacy, can be part of this, but it should be stressed that public health advocacy, like the core discipline of public health, is undertaken through the work of enhancing the health of your communities through improved policies and programs. So some examples of public health policy, there's a lot of them actually out there. We've seen a lot of them over the last 3 years. But in particular, I think of, I know this is kind of dating me again, but in 2006, the Surgeon General at the time did a report, a comprehensive report on secondhand smoke. And I can tell you that all of that research was existing, and they pulled it together and they really orchestrated it, made sure every state had it. There were tons of media coverage and toolkits so that people could really understand and apply the lessons about how secondhand smoke harms communities and harms neighbors and people, right? And so it was advocacy in that it really showed here are all of the harms. So people like to solve a problem, right? So here's the problem and here are solutions. And yes, some of them were legislative solutions, but it didn't tell anybody to go and do it. It just said that these have been shown to be effective, right? And so it was not sort of this deep analytical research papers that are, are hard to, you know, get out into the public, because you need things that are succinct, good messaging, and ways of helping the public respond and understand. And so there has to be that good plan and translation. And I think that was an excellent case of that. I'm sure many of you can also think of others, um, other great ways that, and in particular, this was the Surgeon General. So he's, public health, he's in government. He can't tell Congress what to do, right? All he could do was point to the evidence. And he was pressed often at his presentation and afterwards talking to the press about, well, are you telling Congress to, make the nation smoke free? And he said, No, I'm just saying, look at the evidence, look at what harm there is, and look at what we can do to make change. So when I think of things that we can do, I think about how, in many states, there's the burden of tobacco reports. Well, why don't we do one on alcohol? What does alcohol impact? We've had a couple of those in our state, and it certainly is revealing. Like, people have no idea how harmful excessive alcohol use is. So that can be, really helpful. And it's, you know, data, understanding data isn't really enough. It's being able to take that data, inform people, not overwhelm them, and then point to solutions, point to things that can be done. And again, this is good, clean fun, and I'll explain why that is a little bit later. And also remember, as we're presenting information to the public, because I'm sure, this group is full of people like me who love the data and the research and the nuances and the caveats and all of that. But that in order for folks to really absorb this information, you have to tell stories more than data. So I'll give you an example of that. So when we were working on the Smoke Free campaign, tavern owners and tavern workers came out and would have on their shirts how much money they would lose, the fact that they wouldn't be able to make their child support payments, all of these, they wouldn't be able to send their kids to college, all of these really, horrible things if we pass this law. And so they used the heart, right? They used emotion to try to sway people, where we're like, oh, here's the data on this, and here's how many people are harmed. But over time, we learned that we really needed people to tell their story of how secondhand smoke harms them, how it harms the workers, right? So it's really being able to take, some pieces of information in that data, obviously making it accessible, all of it, and being able to message effectively, so that people can understand, here's what's happening. I understand, because we understand stories better. We're just built that way. Than just data, and being able to wrap that into a nice package can be extraordinarily effective. So, and what can we, who can do it? I love this part. Who can do this? Everybody, right? Communities that are impacted, experts, scientists, physicians, healthcare providers, law enforcement, transportation folks, safety folks, those with different cultural backgrounds. Everybody can be part of that conversation in terms of, this is how we see harm from excessive alcohol use. And then being able to point out the solutions. One of the things I've always thought about is, you can put the dots on the page, right? You might not be connecting them for folks and saying, you should pass this law, right? But you can put the dots on the page. Here's the problem. Here are some solutions. And does it work? I think it can work, but only if we're using all voices, people who are impacted and harmed, and the folks who are, you know, within those systems. So having health professionals speak about what they see in their patients, I think is really helpful in terms of making sure that you have all the voices at the table. But we certainly have seen a lot of public health advocacy, and the American Public Health Association, frequently celebrates different opportunities to show all of the things that have happened to make communities healthier. So public health advocacy roles, there's a lot of them. And it's clear in looking at the American Public Health Association that policy is core to protecting the public's health. And as an expert or one who educates the public, you can convene. The power of convening is really important. And when I saw the different organizations, as you all signed on today, I thought there's a lot of people who have an opportunity to bring people together. And convening is really critical in terms of being able to have, that advocacy role and being able to move things forward in your community. You can help facilitate. Again, you can keep the process moving in terms of bringing people together, supporting that process, having some of that backbone structure to make things happen are really important. And thinking about an implementer, um, supporting those who lead is also really a critical piece. And when you answered the poll about empowering others, I thought a lot of you already have some good skills in that area. And as you pull these groups together and the different roles that people can play, it's important to realize that conflict is not all bad. I think sometimes we don't want to have conflict, but I think it actually helps you think through at times what the opposition is thinking, but also at times realizing what is the political reality of certain things in your state. So, and I love folks adding in, kind of the work that they've done in here. So the public health expert educating the public, engaging the community, and really with engaging the community, I think it's really important that we walk with the community as part of our role there. So being able to advocate does take capacity. So what do folks need to be effective? Well, I think there's a lot that's needed. And I also, as I put up some of these slides, I think I don't want to scare people off, right? There are times when you can do advocacy and you don't need the big manual of running a campaign, right? It kind of depends on where your community is at, and what people are thinking, where your decision makers are and that kind of thing. But I also think it's really important to think about bringing all of these people together, because this is not a one and done game, right? Alcohol policy is in so many different parts of our lives. It's part of the social fabric, right? That we do need to be able to build a strong capacity, um, you know, in there. I also see in the chat, when we engage, we hear from those we're trying to serve. And I think that's important. And it feels grassroots is the easiest to do. I think it depends on kind of people's comfort level, but I think it's an incredibly important part of the work. So when I talk about community members, I mean, in a way, we're all community members, right? But I mean, like, people who aren't paid to do this work. And the folks who are most impacted tell the best stories. And that's such a premium in terms of being able to advocate. So recently we were talking in a community about the licensing process, and there were two bars where there was a lot of violence over time and then homicides. And people were telling us that, you know, they have a huge concern about these places being able to continue being open because they walk out their door and there's blood on their doorstep. You're going to remember that comment, right? Because we can all see it, we can all relate to it, and it's true. And so that can cut through a lot of things. And people do have stories that are really compelling and really important to share. Now, the challenge in that particular story is that that person does not want to be retaliated against because of the violence in her neighborhood. And so it's how do we make sure they can tell their story in a way that doesn't endanger their own personal safety? Multiple sectors, this is really showing that this problem permeates many different areas. This is all about violence and law enforcement and traffic safety and, you know, um, assaults, batteries, all of those kinds of things, as well as the healthcare sector. So there's a lot of different people that have stake in how our community responds to excessive alcohol use. Multiple spokespeople, again, people who are able to raise their voice and kind of build that story arc that's so important. It doesn't mean you want people all speaking at the same time, but thinking about if you can keep getting that drumbeat going in communities, it's really great to have different people from different perspectives talking about the same thing. Of course, data and research is really important when done effectively. And I think, we're learning so much just around the country about how to really effectively communicate the data and the research on reducing excessive alcohol use. Of course, media relations are important, and that game has changed a lot, right, with social media and all of that. But I do think that there's still value with earned media. So working with TV, radio, and newspapers, and what you can do in terms of sharing that out on social media platforms. But also understanding who listens to whom, and understanding how to be part of that media. Grassroots. So again, people who are supportive, people who can nudge their whoever needs to nudge. Sometimes it's police departments, sometimes it's city councils, sometimes it's states legislatures, but that you have people who are educated on the issues, understand it, and are ready to respond. I wonder how many of you have heard of grass tops. Sometimes I say that term and I get a lot of blank faces. So when I say grass tops, I'm really thinking about the people who are influencers, so they've been on the county board, they're no longer there, but they've got the ear of several critical people on that county board. Folks who, I mean, really just who have influence in the community. They may or may not hold any elected position, but they hold a lot of capital in their area. And so it's important to pay attention to, um, having some grass tops on your team, but also understanding who other grass tops are. Did I miss anything here? Folks have other um, thoughts about what kind of folks and capacity you need to be able to advocate? Hope I'm not all losing you after lunch here. Yes, success in history is definitely an important piece. Success showing that you've got what it takes to get things done. I think youth can be very effective. Lived experience, absolutely. Thanks, Chad. That's great. Financial support, absolutely, yes. Um, definitely funding makes a difference. All right. All right, so now we're going to go to the lobbying side of this. What are the lobbying fundamentals? So generally asking someone in a governmental decision making, who has power to support or oppose or introduce legislation. So that's kind of the very quick of it. And I'm going to talk a little bit about federal lobbying laws. Your state and local lobbying laws may be very different. In our state, when you put federal and state together, it's like you have to report on two pretty different things. It's kind of interesting. And then making sure that you're clear on which level of government you're working with. And again, always be aware of the regulations around that. School boards are an exception in many places, and so that would also be something to check. I don't know how it is, but you can't lobby school boards, like even if you try. So that's just something to kind of keep in mind, but also to check. So the federal definition of lobbying is, the oral, written, or electronic communications in an attempt to influence, forming legislation, modifying it, or adopting it. It can also be to the administration or executive level of a federal program or policy. Federal rules, regulations, executive orders, or position of the US government is also considered lobbying. And then the nomination of folks is part of that piece too. So as you think about that, I also want you to think about who can be lobbied. This has certainly come up in a lot of the work that I've done over the years. So, on the federal level, obviously Congress and senators, executive branch officials, the president, those all can be lobbied. But you also got to think about like executive branch officials, secretaries, right, of cabinets are part of that. On the local level, if you have those regulations, mayors, city council members, county board members, can all be lobbied. At the state level, your governor, the secretary, the cabinet level, and sometimes that goes down. So we almost have like a water line in terms of what is their decision-making power. Um, and if it is above the line, they're considered, you can lobby them. If it's below, you won't. So for example, working with our state health officer, because they don't have the power of regulation, we can talk to them all we want and work with them on things. So it's kind of interesting to understand that, you know, in terms of who can actually be lobbied. And again, may vary in different states as well. So out of this, I want you to take two things, and there's a lot more to it, but I just want, if you are concerned, ask yourself two questions if you're lobbying. Is it on specific legislation, regulation, or rule? And are you asking them to do something? Oppose, vote for, amend, kill, whatever. So it's two things: specific legislation and asking them to do an action. Now, that's not to say other things aren't lobbying, but those are the big two, to watch out for. So other things that you have to consider is if you're doing this as part of your organization, it's really important to understand what the policy around lobbying is in your organization. As a 501c3, there are options to actually do direct lobbying, but not every organization takes advantage of those things. And so it's really important to understand, if you're working for a 501c3, does your organization have a registered lobbyist? Do they have rules on lobbying? What is your corporate counsel if you're in, like a county government or other government? What do they say? about the rules. So this can be above and beyond what the actual law or regulations are, but understand what the policies are, because we don't want you doing anything that will jeopardize your role with an organization, of course. You also have to know what kind of funds do you have. So if you're 100% federally funded, you're not going to lobby. You need to have unrestricted dollars in order to do that. So those are important things to take note of. It's also important to understand what reporting requirements are. So if you are allowed to lobby, that you have funds that allow you to do that, you may not have to register as a lobbyist. We get time to do that, for example, in our state, like 4 times every 6 months, to go talk to people who are not our legislators about things. And then what kind of reporting requirements do they have? So making sure that you're following that as well. Um, Usually those aren't too difficult, but it's important to make sure you think about those things before you get involved. And then your role. What hat are you wearing? Are you working for the organization? Is this, kind of under their umbrella? Or are you working with your professional association on your own time? Are you working on your own? And the important thing in this, especially if you have any governmental funding or are, government, is that you do things on your own time, your own dime, and your own equipment. Otherwise, this gets really messy. So make sure you think about what the organizational policies are, what the legal pieces of your organization and what they think about this, and what role. You may want to take a day and go, lobby with whatever association that you are part of. But you need to understand what those roles are and make sure that that's all thumbs up in your organization. Are there any questions as we go here? Feel free to pop those into the chat. Because I'm kind of just skimming a little bit. There's much more to talk about, but I think these give you some ideas of things to think about. So the other piece I wanted to share is what is not lobbying. And there's a lot. The list of what is not lobbying is actually longer than the list of what is lobbying. So, if you are doing, a speech or write an article, publication, and it goes through mass communications, and it doesn't say, go tell Senator so-and-so to do X, Y, Z on this, you're not lobbying. If you request, like a status of what's happening, have an administrative request or, want a meeting, that does not mean that you're lobbying. Now, this is federal lobbying. Testimony before Congress isn't considered lobbying. In our state, testimony in front of our legislature is considered lobbying, though you can do it for information only, but it's safest if you are invited to do so in our state. If there is a request for a response, again, on the federal level, that is not considered lobbying. Obviously, subpoena or civil investigation. Written comment, again, on the federal level, that's a little bit different than our state level. So if we have a written comment that tells you oppose, or make an amendment or whatnot, then that can be lobbying. But again, it depends on your state's rules. And then I love this part, anything through the media, it's really hard to lobby through the media. Again, with that exception of calling on the public to call a certain person to tell them to do something on a specific piece of legislation. But I find in many cases that that's not an effective message out into the public, and really being able to have people understand what the problems are and what the solutions are is really an important piece, and again, not lobbying. So lots of avenues, as I would say, for good, clean fun. So any questions? Again, feel free to put something in the chat if there's anything you'd like clarification on. Oh, it looks like we got.
You have a question from Chad Childs. Chad Childs' question is, in Kansas, the law prohibits encouraging legislators to vote a certain way and prohibits encouraging anyone to encourage legislators to vote in a certain way. Is that true in other places? Sometimes folks are tempted to encourage the youth in their community to talk to their elected. This gets tricky. We have to be very careful to clearly provide education and advocacy and avoid lobbying. Block grant funded. So
Yes, that's a great question. There's a difference between talking and educating your decision makers um, versus having them actually lobby. So, and it's a line that you really have to make clear with youth. I've certainly seen that in a lot of the work that we've done, because sometimes they'll just step over the line and you're like, oops. So it's really important that they stick to the education, the data, the information, their stories, and not be encouraging them to tell their legislators to do something, and not encourage others to tell their legislators. Those are, so grassroots lobbying is telling others to tell their legislators to do something, and direct lobbying is telling your legislator to vote a certain way. Not your legislator, I should say legislators. Again, something to check on your state law, but we are free to talk to our own legislators. You know, so people who represent you, you're their constituent, you can talk to them, and that is not considered lobbying because they represent you. Again, because of sometimes the public nature of our positions, it's really important that you do that from your home email or your own phone, or things like that, just to make sure there's no lines blurred. But you are allowed to talk to your own legislators, generally speaking. So does that answer your question, Chad?
Yeah, it does. Thank you.
You bet. Great. Okay. So now we're going to get started. So we want to talk a little bit about, some of these activities you can use in terms of really engaging in policy work. So having a clear goal is really important, and there's a whole process that you can put to that. But making sure you have a goal of the thing you're going to do. But I also think that a lot of people benefit from having, like, here's what we want to do big, and here's what we're going to do on this today, right? It's funny how having a North Star can be so helpful in leading you through this whole process. Doesn't mean you're, taking on the whole thing, but identify that clear goal. And so what can you do? Like setting standards for a community. So what if you would like to see 5 important organizations adopt a policy to have better community standards about alcohol at their events, right? So that could be your goal. For example, we have domestic violence shelters having fundraisers at breweries. We have axe throwing events with all you can drink alcohol to raise money for charity. So these are things that are really counter to the work that we would like to see doing. So think about the things that you want to have happen, what those are, and then determine about who is engaged. So as we go, I'd love to have you add, sorry, your thoughts to the chat. Who should be part of this process? What about the people that CBOs serve, your community-based organization? And who do community members listen to? So think about those things as you think about who should be engaged. And making sure that you've got participation of the community, a variety of population stakeholders. It's really critical to think about that. If you're working with schools, as a lot are, who should be involved in that? What is it that you want schools to do? Like, it could be a variety of things, right? Having the electronic short brief interviewing process, that screening tool, as part of the work of the school. Or maybe your school sports are, like 5K soccer is on a field that the brewery owns and the parents are drinking beer. Maybe that's not a great idea. And maybe the school should change their policy about using fields that are owned by the alcohol industry. So think about, those kinds of policies are a way of kind of stepping in. Some of you might be thinking much larger policies, but I wanted to give you some idea of some organizational level policies that you could start testing and building that capacity for. So who do you need there? Who are the stakeholders and the voices that you need? Are there folks adding into the chats?
I'm not seeing anyone add into the chat just yet,
Okay.
but
Yeah.
I do have a question. Oftentimes the alcohol industry wants to participate in your prevention strategies. And it seems that has forever been one of those questions that has dogged preventionists, right? Like, how are we inclusive without using their strategies that don't work in our work? So how do you, when you're getting started and those folks are coming out of the woodwork, are they a stakeholder? How do you include them? How do you not include them? All of those things.
Yeah, I think that's a great question. And so as I think about it, and think about this, if there's your drug-free community grantee and you've got the 12 sectors, I think about how some of those sectors can be challenging. Not probably the alcohol industry is the most challenging. In our state, it was the Tavern League wanting to help out as well. And I think there's a point of who makes decisions and who do you have relationships with? So I would draw that distinction. The folks who drive the work and make the decisions about the strategies, in my opinion, should not be with ties to the alcohol industry.
Well,
That
thank you.
those who you have relationships with, because there are times we're on the same page with the Tavern League or the wholesalers or whatnot. So it's not in my interest to alienate them or not have relationships with them or not have conversations, or, invite them to a meeting perhaps, but I don't want them to be part of the decision making. I would also, just kind of as a point, I think it's also troubling when elected officials are there too. They can be very passionate, they can be really helpful, they can be a champion, but I've had the experience over and over again where an elected official gets involved because they care, and you let them into the decision-making group and they say, oh, no, don't do that much advocacy. I've got this. Or, don't ask for too much money and the legislature will appreciate that. Well, they appreciated it so much they took another 30% out of our funding request. So, be careful in terms of who makes decisions and who you have relationships with.
Well, Maureen, there's some other comments here in the chat box. Someone said you'd have to be really prepared, but maybe people from the alcohol industry, which speaks to what we've been talking about. Interesting. Alcohol industry also, community taxpayers attend school and church, claim civic responsibility. Another person said, make sure you're all on the same page as to what the end goal is. We also have heard you always want to include those who the policy are intended for. to be involved in the planning and implementation. Nothing about us without us. And that is always a perfect good preventionist statement to make. And then consider this. Do we care about who we alienate? I think that that's a good question, Marie. Do we care about who we alienate?
Yeah, that's a great question. And I would say you have to be really careful about that. If we had painted a brush of everyone who had ever taken Philip Morris money, we would have never gotten our best ally on the smoke-free fight in Wisconsin. So the Restaurant Association used to take, tobacco money, and then they changed their mind and they ended up being side-by-side advocates with us on the smoke-free air law, because they wanted everybody to have the same law instead of a patchwork, because we had local ordinances. And so if we had not been willing to open the door and hear where they were coming from, and just always paint them with that brush, we could have alienated them and not, and then honestly, I don't think we would have passed the law, because they brought the rest of the hospitality industry along with them, except the Tavern League and the music vendors and, the dartboard people. So, but the rest of the hospitality industry was on board. So I think you want to be careful who you alienate in that calculation. Now, I was happy to alienate Philip Morris and, some of those folks, but that was clear where they were coming from. The alcohol industry is so diverse and complex, and there's so much interwarring that goes on. I'm not sure I would want to make anybody overly angry with me in the work that we do, because they might be an ally on the next issue. So I think that's something really important to think about, unless you know that there's just no redeeming thing ever.
Thank you. Another person said you should always include your funder.
And I love that point, because I think it's important to tell our funders what we're doing with their money, right? And I know we have to be making sure we're kind of in line with the grants and not, how do I say this? Not going too far, maybe. But your funders are often your legislators. They're your county board people. So working with, the fiscal agents and the department that gave you the grant, I think it's really important to talk to your funders. I don't think we would ignore them with other grants, but sometimes we get funny when they're government grants. Yes, and yes, this next point about being cautious about seeking grants from the local industry, that can really have a lot of people question, where you really are at on the issues. And I know there's tons of considerations with that, but we just had a domestic violence kind of ad go up that a brewery is labeling 1 in 4 women have experienced domestic violence, because the man who owns the brewery, his niece died from a domestic violence interaction, and he wanted to raise awareness. The challenge is he's raising awareness with a product that contributes significantly to some of that. So it's complicated. I wish I had all the answers. So this is another place where I want folks to think about community participation. And I know many of you know this really well, but thinking about, as you approach partners, think about their history with the issue, cultural norms, existing relationships, and needs. So we're working with the Lac du Flambeau tribe and really actually funding measures to bring back their culture, and make sure that those, family circles are available for them. And then they work on not only individual, experience with alcohol, but also the tribe's experience with alcohol and what that does in the community to bring about change in policy. So really thinking about what is the best way that your partners, they know how to work in the community, and really giving space and frankly funding to those kinds of things. Um, Obviously making sure that the information is culturally responsive. What's the best way to do that? Work with people from the community to develop those materials. I think that's important. Building relationships takes time. A lot of folks are doing the one-on-one relationship building. I think that can be extremely effective. And being humble, culturally humble when working with our partners. Um, a lifelong commitment to self-evaluation critique, to redress power imbalances and develop mutually beneficial and non-parentalistic partnerships with communities on behalf of individuals and defined populations. This is not a new concept, that was developed. And it's certainly something I think about when approaching pretty much anyone. What do they know? Where do they come from? What are their thoughts? Um, what what can I learn from them? Because I learn from people every single day. Also, when you think about this, think about how you've been asked to participate in things. What's worked? So I want you to think about that. I was asked to help out with an alderperson's campaign, and she called me up and asked, she had a job for me to do. Instead of like this open thing, like you're going to help out with everything, she said, can you do X? I didn't think I had time to get involved with the whole campaign, but I could do X, right? So thinking about that as well. So now we'd love to have you all share out. How are you getting started? Maybe some of you are already started.
I know we had quite a few novices and folks who've not gotten started yet, but we did have a couple experts. So some of the experts, those who tick that they are experts, or those who are even novices, you don't have to tell us which one you chose, whether you're a novice or an expert, but how did you get started? I think that that's a great question. So you've gotten started, how'd you do it? Robbie Mullins, man, she's a preventionist. I tell you, she's been doing this for a while. She says, assessing what is already in place. So Robbie, what do you mean? If you could open up your line and just tell us what do you mean by assessing what's already in place? And while Robbie's opening up her line, I'll read. Betsy says, community mapping hotspots with lots of people.
Okay, LaShonda. Well, we are tasked with actually looking in what policies are already in place, and if they're effective policies or not, or what can be enhanced, or if they're being enforced mainly. A policy, an ordinance, and a law is only as good as what's enforced. So other than that, it's just a piece of paper sometimes. And so that's critical to what you're looking at when you go to look for policies or what you're seeking to try to change.
Thank you, Robbie. I mean,
and of course,
your logic model, your goal and your outcome is not to have a policy change, right? In your logic model, it's to make change is what it is. So much of what you said is quite accurate in the logic model. What else were you going to say, Fred?
Oh, I was just going to say, and absolutely, we use our coalitions in our communities to work with us.
Thank you. Maureen, you also had Sharon who said, we are currently examining the new alcohol to go legislation that is now permanent in Texas, advocating and educating community legislators about what possible negative consequences may result. And then Jenny shared, presented at DWI Planning Council to some legislative representatives regarding a great research released in our community by New Mexico In Depth around how alcohol policy has impacted New Mexico, having the highest rate of alcohol death in the nation. Also working with local coalitions, she echoed what Robbie Mullins said.
Those are all great comments. And I think bringing back what the impact of these laws are can be really helpful in helping to change them. It is hard to change them once they're already in practice, but that is really the best strategy. And I agree with everything you said, Robbie, in terms of enforcement. It's often a trick of the industry is to try to gut enforcement if they can't stop something going through. And then New Mexico, you all have been doing awesome work. I've been watching. So, and your in-depth media coverage and that kind of thing. So my hat's off to you and the work that you're working on.
So we're pausing for any other questions or comments that you all may have for Maureen. And if you don't have those right now, don't forget, this is part 1 of a 2-part series. So please come back tomorrow at the same time. And we are really going to talk about implementation. And so Dia Caldwell has placed the link in the chat box. If you have not registered, register for part 2. I'll also let you know that you will get a copy in your email of this slide deck, but you'll also get a couple handouts which will help you as you move forward in your policy work. And so we'll take one more pause for questions. And I think at this point we're at evaluations, am I correct? So here are references and we'll keep moving to the evaluation link. So we would hope that you all would, again, join us tomorrow. And then please, provide us some feedback on today's presentation. We're so appreciative of your time and your expertise that you've shared with us today, Maureen. Thank you so much. I can't wait for tomorrow. And I can't wait to see all of our friends out there, some that I've mentioned and some that we're just making new friends with. So please come back tomorrow. Don't forget to fill out our survey on today's presentation, and I hope you take care.